depending on your perspective, we're very close, right? We've done a lot of work. It's a relatively new field, honestly. We're talking in the last, decade, who was, looking at really clearly at NGS testing. So there's been a lot of progress. We certainly have materials that are able to standardize utilization, standardize our reads and uptake. But at the same time, there is probably some, maybe not cultural, political barrier. You're gonna have to massage this one, but maybe not cultural, political barriers, but just structural barriers to kind of ubiquitous use, right? There obviously, because it's a relatively new technology, we're trying to standardize it. There are going to be those limitations of previous activity, right? So liquid biopsy in general is probably not going to be a replacement for solid tumor biopsies, but will serve to augment and add to the data and the information that we're able to glean from those biopsies. But there are processes in every hospital and every hospital system around the world that ask us to use those solid tumor biopsies, right? And then there's training systems in every university around the world that educates doctors on how to look at pathology and identify what it is that they're looking at, right? So in instituting NGS testing or any kind of liquid biopsy into the solid tumor biopsy world is going to require just a little more, I guess, upscaling of activity when it comes to just an add-on of utility. So I think we're very close, but the barriers now, as we kind of tick off the technology barriers, the barriers are really going to be ones of education, utilization, and insertion into an existing paradigm.